sea of white blood cells with some dead bacteria in there. Okay. If somebody has like a boil or an inflammatory lesion on the surface of the skin and it's draining pus, how do we describe it? What do we say? It's if a lesion is draining pus, we say, oh, that lesion is
Pussy.
what? How do you spell that? No, we never use that in the medical record. We use the term, in the medical record, we use the term purulent. Purulent.
I was about to say infected.
No, purulent. So you'll hear
Oh, that
this
was a
term a
good
lot.
guess.
If somebody has a lesion that's draining pus, they'll denote in the medical record that's a purulent lesion. Okay? That, what you said, by the way, is I've heard that before. One time we had a.
Sure, this is good.
This is a funny story. There was a recently graduated Michael Acevedo from nursing school. At one time, Alice gets upset.
I didn't even have a guess, so.
He does. I don't want to have to go to human resources again.
How many times you been?
I know.
So, but the truth is, what's funny is he's so sensitive, but if you would go to medical school or PA school, this is something, you have to talk about it, okay? So it's not something that is necessarily, should be forbidden, or it shouldn't, this is just life, okay? But you'd be surprised how many times I'll use words or terms or put in quotes what patients say, and it offends somebody, usually it's not Alice. But, so, at one point a few years ago, I was teaching microbiology, and we're talking about sexually transmitted diseases. And we were differentiating between, for instance, chlamydia and syphilis and gonorrhea. That's why gonorrhea, she said. Okay, and so there are a number of different ways that you can differentiate these three sexually transmitted diseases. And by the appearance, and one thing is by the discharge. Okay, and so and there are a number of different characteristics. So I had a chart like this on the board. I said, Michael, I want you to come up here, and I want you to kind of fill out this table. How would you differentiate these diseases? And so when he gets to chlamydia, he says it's a mucoid discharge, which is true. And then he gets to gonorrhea, and he puts he meant to say, I guess, that it's a pussy discharge. And so I said, no, we never say that. And so I said, well, it is. And I said, you would never put that in the medical record.
He didn't say puss-like. He should say like puss.
Well, the term is purulent. That's the term we like to use. Okay, purulent.
Well, it is.
Wait, when
It's
you
already in my
get
notes.
someone
Like, you
with
said
a
ing.
Yeah, I said ing.
It can be
Pussy.
But I knew what he meant when he said how do you spell that?
Okay. So, a leukopoiesis, remember we talked about erythropoiesis, production of red blood cells?
Yeah.
Leukopoiesis is production of white blood cells. The site is the same, it's the bone marrow. The regulation is different. Okay? Whereas erythropoietin stimulates stem cells to differentiate along the lines of new red blood cells, the hormones that stimulate the production of white blood cells are different. They're called interleukins and colony stimulating factors. These hormones are released by macrophages and T lymphocytes at the site of tissue invasion. You know, when we talk about connective tissue in AMP1, we said that one of the types of cells that's present in connective tissue is macrophages. Okay? So that if, for instance, let's say we step on a nail, okay? And that nail comes up into the tissue of our skin, the dermis, the subcutaneous tissue. It's not going to come in by itself. It's gonna bring bacteria, unless we're in a sterile environment. And one of the roles of macrophages within a tissue is to ingest those bacteria. Now, they can't ingest all of them, but what they're gonna do is release interleukins and colony-stimulating factors, which travel via the bloodstream to the bone marrow. And in response, the bone marrow starts producing white blood cells that are gonna come to our defense, that are gonna enter into the bloodstream and then target this tissue where the bacteria have invaded, okay, and help us to eradicate that potential infection. Now, that hemocytoblast, in response to these colony-stimulating factors and interleukins, it can differentiate into any of 5 different white blood cell lines. Okay, we talked about the fact that there are 5 different types of white blood cells. Okay. Yeah, I'm gonna ask you him about that. All right. Here's what I want to say.
Oh,
See
I
that?
had-
You should tell me. Give me one. All right. Here's what I want to say. Never let monkeys eat bananas. Yeah. Never let monkeys eat bananas. Write that down. This is extremely important.
Should we draw a stop sign and birds and
Thank you.
stars?
So that was the next step.
Okay.
Never let monkeys eat bananas. So, what you've probably figured out is that that's a mnemonic. The first letter of each of those words stands for one of the types of white blood cells. Never, neutrophils, let, Ellis for lymphocytes. The M for monkeys is really monocytes. Then eosinophils and basophils. And the beautiful thing about this mnemonic is it's also in correct order from the most abundant type of cell to the least abundant. Okay.
So why are they separated into 2 groups on here as A and B?
We'll get to that.
Okay.
We'll get to that.
Sorry.
You're getting ahead of yourself. Good.
Well, yeah, that's how she does
There
it.
you go.
Yeah. All right. Now you take out your highlighter. And I want you to highlight what you just wrote down.
Yeah, this is one of your highlighters.
Now, after you highlight it,
Always gonna prepare things.
now you want to take out a darker marker, and I usually recommend either dark blue, black, or purple, and you want to put some stars all around it. Because when you come back and you're studying, this is going to tell you this is important, okay? Now, for some of you, when you come back and you're studying, the stars by themselves may be enough. Yeah, you get it. You're good. Some of you, no, that's not enough. Okay? So what I'm going to ask you to do is then make a little stop sign and put stop reading. Okay? That's going to be a secondary reminder that, yeah, this is important. It's probably going to be on the test. Okay? Now, let me say this. Some of you are obsessive compulsive and are worried that if you put too many stars on there, too many colors, it's not going to look good, it's going to ruin your mojo, whatever. Okay? And so you're afraid of ruining the aesthetic value of your notes. There are some people who are like that. So I will tell you what you can do is add a couple of birds. Add some aesthetics. Okay? And then all of a sudden, something that may have looked a little bit displaced, now all of a sudden it's like having a nice picture in the center of your notes. It's like, wow, this is almost like a piece of art. And this is some good work here. Okay? Look at this here. Very nice. I like your stop sign, where you colored it in. Very nice. Good. You know, not as colorful, could use a little bit of work. But nice. Remember, she's gone into fashion, we would expect a little bit more. You didn't have your colors, did you? Okay. 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 Well, let me just fire this one a second. Class, I'm gonna leave this up to you guys. What do you think it is?
What color? Oh, what?
I like it. Okay, let me.
All I have is one color.
I offered.
And that happens.
I offered
Hey,
my
listen.
colors.
Listen, this happens. Don't be embarrassed.
He's about to make it no.
I'm gonna help you.
See what
Oh
happens.
no, there's a note it too.
Wait, you're taking up all this space. Now I can't write other notes.
That's okay. This will make up for it. When you see this, you're gonna be good. Yeah, you're
Use
welcome.
the back. There's a whole back piece of paper.
Thank you.
Okay.
Very
So,
helpful.
never let monkeys eat bananas. Now, some of these cells are going to be called, what we call in the business, granulocytes. Yeah, I said it. Granulocytes. I know what you're thinking. What you talking about, Willis? Granulocytes. Granulocytes means that the cells have visible granules in the cytoplasm. Okay, here's the nucleus here. I'm not talking about the nucleus. But in the cytoplasm around the nucleus, there are visible granules. Okay? Those cells we call granulocytes. And that would include the neutrophils, the eosinophils, and the basophils. Okay?
Ah.
On the other hand, lymphocytes and monocytes would be referred to as agranulocytes, meaning that under light microscopy, you can't see any granules within the cytoplasm. Now, by far, the most abundant granulocyte is the neutrophil. And one of the roles, the major roles of neutrophils is to fight acute bacterial infections. So if a patient presents to the hospital with an acute bacterial infection, the bone marrow has already begun to respond by producing buku neutrophils to fight off that infection. Okay? So, if a person comes in, let's say with a pneumonia, with a pneumococcal pneumonia, okay, and we send off the CBC is going to demonstrate a significant increase in the white blood count. Why? Because the bone marrows are responding appropriately to an infection, okay, to interleukins, colony stimulating factors. And it's going to produce predominantly an increase in neutrophils. So if you're watching a medical show like House, they'll be evaluating this patient, and someone will look at the CBC and say, oh, this patient's got a granulocytosis. Have y'all ever heard the term granulocytosis?
Mm-hmm.
It means they have an increased number of granulocytes, and really, what we're really talking about is they have an increased number of neutrophils. Listen next time you're watching, what are the shows now? Like, there's a new one my wife watches.
Code Black? Code Black or Chicago Med?
Yeah.
It's the one where they break all the stereotypes. Like there's this Asian lady who's like the head surgeon, or maybe Grey's Anatomy, that's it.
Yeah.
Oh, Grey's Anatomy. That's not new.
Huh?
Like
Okay,
a decade
I
old.
don't watch them, but my wife loves to watch them.
I thought you were talking. Yeah,
I like Code Black.
That's really ironic, because she's a. Isn't that what
blood clotting, diarrhea, and pneumonia, some kind of chronic bowel.
Who's that, Glenn Fry?
Yeah, please, one of the singers, the Eagles.
Oh, okay. Yeah, I didn't read it. I saw something about that on Facebook. I didn't read about it.
That's my dad.
All right. All right. I'll try that at home. What are some properties of white blood cells? All white blood cells are capable of diapedesis, amoeboid movement, chemotaxis, and phagocytosis. Let's break down. Diapedesis is the ability to squeeze through the lining of blood vessels, particularly capillaries and small venules, so that they can then enter the tissue that's being attacked. So diapedesis is the ability to squeeze through the lining of tiny blood vessels, mostly capillaries and postcapillary venules, to reach tissues. Okay? Now, once they make it into the tissues, here's what they do. They send out little cytoplasmic extensions, like this. So it looks like they're walking through to the site where the bacteria are present. We call that amoeboid movement. Then, another property, chemotaxis. Chemotaxis means they're attracted to the site where the bacteria are present. In other words, they will follow a trail. Okay? It's movement toward inflammatory stimulus. So obviously, either the bacteria or the macrophages that first ingest them are releasing some chemicals that can be sensed by the white blood cells that then move toward that stimulus. And once they reach that stimulus, phagocytosis, the ability to ingest and then digest the foreign particles, foreign agents. So those are all properties of white blood cells. Now we're going to talk about the most abundant of the white blood cell types, the neutrophil. I'm going to mention first, I'm going to talk a little bit about its appearance.